Sure.
Thank you, Mr. President. I rise today to join my friend and colleague, Senator Shaheen, to discuss the stories and concerns we heard from our constituents in New Hampshire about how they would be hurt if Trumpcare becomes law. And even though Republican leadership has delayed a vote on Trumpcare this week, we know that the fundamentals of what is wrong with Trumpcare will not change. Trumpcare would force Granite staters to pay more for worse insurance, all to give billions of dollars in tax breaks to corporate special interests, including Big Pharma, at the expense of hardworking Americans and the programs they rely on. This is the basic principle of Trumpcare, and it's unacceptable. Mr. President, Trumpcare would be a disaster for people in New Hampshire. Granite staters know this, and they have been standing up and speaking out against this dangerous bill. As Senator Shaheen discussed, we held an emergency hearing last week in Concord to hear from our constituents about how Trumpcare would impact them. We held this emergency hearing at 2 p.m. on a Friday afternoon in the summer with just a day's notice, yet hundreds of people showed up. And over 50 people shared their personal stories about the importance of health care, of how they have benefited from the important protections that are provided under current law, including maternity care, prescription drug coverage, and coverage for substance use disorder services, of the protections against insurance company abuses, of Medicaid expansion, of traditional Medicaid. They told us what their lives were like and why Trumpcare would be devastating to them and their families. I'd like to share some of those stories here today. We heard from Arielle from Rochester, New Hampshire, a mother who is benefiting from substance use disorder services that are included in Medicaid expansion and would be taken away under Trumpcare. Arielle said, and here's a quote, "I'm a mother of 3 children, and I have a substance abuse disorder. I come from a long line of women who never had much opportunity. With the opportunity to have Medicaid, I've been given the chance of treatment. Without the chance of treatment, I wouldn't have been taught that there's a solution and a way to live a full, beautiful life as a woman in recovery, as a mother of 3 beautiful children, as a woman of dignity and grace. If the opportunity of Medicaid is taken away, the chance of positive change in this world is going to drastically drop. Women like me may never know a world outside of drug use and hopelessness." She goes on, "Today, because of the opportunity of change, I am able to be a positive role model to my children and, most importantly, our future." When we met Arielle, she was pregnant with that 3rd child, and she went into labor immediately following our field hearing. She told us over the weekend that she had a healthy baby boy, and because of the treatment Arielle received through Medicaid, she is in a better position to take care of that new baby boy. Our Medicaid program is not only critical to providing key support to combat the substance misuse crisis, it also, as Senator Shaheen mentioned, helps seniors and those who experience disabilities get the care that they need, services that would be taken away under Trumpcare. This is something we heard from a Granite stater named Jeff, who has a form of muscular dystrophy. Jeff said, and here's his quote, "I am able to live a life that's independent in my own home, pursuing my own career, only by virtue of the fact that I'm able to receive Medicaid services. Specifically, all this discussion about private insurance is well and good," said Jeff, "but I think what some senators aren't remembering or don't know is that private insurance doesn't cover many of the types of services that Medicaid does." Jeff went on, "Especially personal care services that allow us to live independently in our homes and communities, which is where all of us would like to be if we're able to. So I'm concerned about that." He continued, quote, "I'm concerned about the fact that my understanding is that this bill would allow states to opt out of providing optional Medicaid services, many of which are the waiver programs here in the state that frankly are so vital to folks with physical disabilities, developmental disabilities, acquired brain injuries, and all sorts of other conditions. So that part concerns me. Medicaid coverage makes it possible for Jeff and so many others to work and participate in their communities. Jeff also said that he was concerned about the fact that Trumpcare cuts and caps Medicaid, which we know is really just code words for massive cuts that would force states to choose between slashing benefits, reducing the number of people who can get care, or doing both. Senator Shaheen and I also heard from several Granite staters who have benefited from the Affordable Care Act and who are concerned that Trumpcare would reduce the care they receive while raising their costs. One of these people was Enna from Exeter, New Hampshire. Enna said, quote, "I am self-employed and purchase health insurance through the marketplace here in New Hampshire. The ACA has given me the opportunity to purchase affordable health insurance for myself and my family of 4. She explained, quote again, "We were unable to maintain insurance consistently prior to the ACA, and even when we did have it, critical preventive care for myself as a woman was not covered by our previous policy." She said that Trumpcare would, quote, "make our health coverage less comprehensive and less affordable. I am certain that our risk of financial and/or health catastrophe would be significantly greater under Trumpcare." Mr. President, there is no doubt that we should all be working together in order to improve the Affordable Care Act, build on the progress that we've made, and lower health care costs for all of our citizens. And I'm willing to work with any of my colleagues on bipartisan solutions in order to make that happen. But we know that Trumpcare is not the answer. While my Republican colleagues have delayed a vote on this bill, no one believes that Trumpcare is dead yet. I am going to continue to share the stories of Granite staters who would have to pay more money for less care under Trumpcare. I will keep working to ensure that Trumpcare never becomes law. And I urge my colleagues to take the time to listen to their constituents who would be hurt under Trumpcare. Mr. President, the people of New Hampshire have been so brave. They have come forward and they have talked about their most personal, difficult, and challenging experiences. They have laid themselves bare before the rest of us so we could understand what they have gone through, and that we could understand that if we are not committed to a health care system in which every American, citizens in a democracy, have meaningful, truly affordable access to the type of care that each of us would want for our own family, then we are not doing our job as a democracy at all. We need to protect and defend what we have, and then we need to improve what we have. We need to come together and make sure that health care is truly available to every one of us so that we can be healthy and productive, and so that we can lead together. Thank you, Mr.